the CNS is a very big system, and the commands that you usually get in the exams is not the examination of the CNS as a whole, but a part of it. For example, you can be told to examine the cranial nerves, or you can be told that you have to examine the neurological part of the lower legs. So the exam is usually not the whole of the CNS, and we will examine the various parts of the CNS in different parts. First, let us look at the cranial nerve. And the first cranial nerve, as you know, is the olfactory nerve, which is concerned with the sense of smell. For checking the sense of the smell, what you can do is that you can use certain objects that are placed on the bedside table of the patient. Or if you are well prepared, you can put these things in small bottles so that the patient really does not know what is in there, and you test the sense of smell. And you have to test it one nostril at a time. That is, you close one nostril and spray into one of the nostrils and ask the patient what it smells like. Then you can close that nostril and push the substance into the other nostril and ask the patient about it. The second cranial nerve is the optic nerve, and in testing the optic nerve, you have to look for 4 or 5 points. One is the visual acuity, other is the visual fields, then you have color vision, fundoscopy, and the pupillary reflexes. So as far as the visual acuity is concerned, if you don't have anything with you, you can, and the patient is literate, you can ask what is written on the wall or what is written on the calendar. Ideally, you can have a small Snellen's chart with you. But as far as this Snellen's chart, you have to know the distance from which the patient should be able to read it. So you place it at a distance and ask the patient one eye at a time to read the Snellen's chart. And if there is any problem with the visual acuity, you can go for a formal testing of the visual acuity. Then you go for the visual field, and on the bedside, what you do is that you seat yourself in front of the patient. Now you ask the patient to close one of his eyes and close your eye at the same time. Now you ask the patient to look into your eye and ask the patient to report to you the moment he sees the moving finger. And you have to bring the moving finger from 4 directions. You instruct the patient that he is not supposed to look towards the moving finger, but towards your eye only. महाराज ये उंगली हिलते हुए नजर आए ना, फिर मुझे ऊपर नहीं देखना. This test is obviously reliable if you have got a normal visual field. Now you place the hand over the other eye and ask him to look into your eye, and similarly test the visual fields of the other side. In case you find that there is some defect in the visual field, you can go for a formal perimetry testing. Once you are done with that, sometimes if you have a red object with you, you can you can look for the blind spot, and you can look for the visual field effects of the central vision. And you ask the patient to keep looking at you while you move the red object from the periphery and tell you where he is not able to see that. That would be the blind spot. And similarly, you can detect any central scotomas if they are present. Now, once you are finished with the visual fields, You can ask the patient about color vision to find out whether he is colorblind to any specific color. You can have 3-4 objects, red, green, blue, and ask them about the color. Here. You can ask about the colors of the objects. Then the next part is the pupillary reflexes. And for the pupillary reflexes, you have to have the patient in ample light and test one eye at a time. There are 3 types of pupillary reflexes you would like to see. One is the direct pupillary reflex, the other is the consensual pupillary reflex, and third is the reflex for accommodation. You place your hand over the nose and you ask the patient to look into a distance. Now you bring the torch from the periphery and look at the pupil. Look for the constriction of the pupil. Make sure the light that you are throwing on the eye is not going towards the other eye as well. Then you look for the pupillary reflex on the other side. For the consensual, you throw the light on this eye while you look into the pupil of the other eye to see whether it is constricting or not. Then you have to ask the patient to look at a distance and then towards the finger. This is the accommodation reflex. That is, when the patient is looking at a distance and then he starts looking at your finger, there is constriction of the pupil because of the accommodation reflex. So once you are finished with the optic nerve, you go on to the 3rd, 4th and 6th cranial nerves, which innervate the extraocular muscles. All the extraocular muscles except the superior oblique and the lateral rectus, they are supplied by the 3rd cranial nerve. The superior oblique is supplied by the 4th cranial nerve or the trochlear nerve, and the abducens or the 6th cranial nerve supplies the lateral rectus. You ask the patient to look towards your finger, and you test both eyes at the same time. You tell the patient that wherever he sees 2 fingers instead of 1, he should tell you. यहाँ भी उंगलियां 2 नजर आए ना, मेरी उंगली की तरफ देखते रहे, ठीक है? उंगली की तरफ देखते हैं, ठीक है? इधर So you are finished with the 3rd, 4th and 6th cranial nerve. Then you go on to the examination of the 5th cranial nerve, which is mainly a sensory nerve. But it has got a small motor part as well. महसूस होता है, इधर भी एक जैसा होता है. You feel the touch sensation with a cotton wool, and then you make a wick out of it and go for the corneal reflex. You ask the patient to look to the other side, and while avoiding the eyelashes, you touch the cornea. इधर देखो, पूरी आँख पूरी खोलो, आँख पूरी खोलो. And you look for the corneal reflex on this side and the corneal reflex on the other side. Then you can do it with a pin, which should be a new pin and should be a disposable one. Once you are finished with the sensory part, you go on to the motor part. Ask the patient to cleanse the teeth, and you feel for the masseter and the temporalis that stand out. Then you ask the patient to open the mouth against resistance, and you would be looking for the mylohyoid muscles. Then you go for the jaw jerk. And this finishes the examination of the first cranial nerve. Then you move on to the seventh cranial nerve, which is mainly a motor nerve, and it supplies all the muscles of the face. You ask the patient to look up, and you look at the wrinkles on the symmetry of the wrinkles on the two sides. You ask the patient to close the eyes, and you try to open them. Then you ask the patient to show his teeth. This sort of completes the motor part of the seventh cranial nerve. Now if you have some substances with which you can test the taste of the patient, preferably in some bottle, you ask the patient to stick out his tongue and you place the substance, a drop of it on the tongue, and you ask the patient whether it is sweet, sour or bitter. Because this is the sensory part of the seventh cranial nerve, and it carries the taste sensations from the anterior two-thirds of the tongue. Now you can do the examination of the eighth cranial nerve, which is mainly concerned with hearing and concerned with maintenance of posture. You can do it without tuning fork by whispering into the ear of the patient. मुझे बताने में क्या बोल रहा हूँ ना? Or you can do it with a tuning fork. The tuning fork that you would be needing for this examination will be of 512 Hz. Place it over the mastoid of the patient, and once the patient stops hearing it through the mastoid, you bring it in front of the ear. This is the bone conduction and this is the air conduction. And we know that air conduction is supposed to be twice as long as the bone conduction. The ear which is defective, in which the conduction is poor, the air conduction will not be there and bone conduction will be there. Then you have the Weber's test, in which if I raise the tuning fork and place it over the forehead, this would tell you about the ear which is defective, and the patient will be able to hear better in the ear which is defective. Then you can test the vestibular part of the eighth cranial nerve by asking the patient to lie down and tilt his head in different positions and find out if he has got vertigo in certain positions. Then you come to the ninth and the 10th cranial nerve, for which you would be looking for the movement of the palate and the uvula. You take a disposable tongue depressor, fit it with your torch, and you look for the movement of the palate and the uvula. Then you can have a disposable straw with you, open the mouth and touch the palate and the uvula with a straw. This will tell you about the 9th and the 10th cranial nerve. Then as we come to the 11th cranial nerve, you ask the patient to shrug his shoulders while you press downwards. You ask the patient to tilt to one side, and you look for the sternomastoid standing out. So this is the 11th cranial nerve. Then you can examine the 12th cranial nerve, in which you look at the tongue and look for any wasting or fasciculations inside the mouth. Then you ask the patient to stick out the tongue, and you look for any wasting or deviation to one side. You ask the patient to press against the right cheek, the left cheek, and feel for the strength with which the patient is pressing. And this sort of completes the examination of the cranial nerves. Before you finish the examination of the cranial nerve, you can go for fundoscopy, which is mainly a part of the optic nerve, but you can do it as